Here's an account written by a doctor. He said, "More and more of my patients who are recovering from serious illnesses tell me that there is life after death. There is a heaven and a hell. I had always thought of death as a painless extinction. I had bet my life on it. Now I have had to reconsider my own destiny, and what I have found isn't good. I have found it really may not be safe to die. The turning point in my own thinking occurred because of the event I alluded to previously. I requested that a patient perform what is called a stress test to evaluate complaints of chest pains. In this test, we exercise the patient and simultaneously record the heartbeat. A treadmill machine places the patient's exercise so that he slowly builds up to a jog, then to a run. If the heart record ECG goes haywire during the exercise, we can usually be sure the patient's chest pains originate in the heart, explaining the source of his angina or pain in the chest. This patient was a 48-year-old white male who was a rural mail carrier. That means he was of a medium build, dark haired, and had a personality that would please anyone. Unfortunately, he represented one of the most rare when the ECG not only went haywire, but the heart stopped altogether. He had a cardiac arrest and dropped dead right in my office. Instead of fibrillating, twitching. There we go. Without a beat, the heart had just plain stopped. He crumbled to the floor lifeless. With my ear to his chest, I could hear no heartbeat at all. With my hand alongside his Adam's apple, I could feel no pulse. He gave one or two sighing breaths before he quit breathing altogether. There were scattered muscle twitchings and then convulsions. He was gradually turning blue. Although 6 other doctors work as partners in the same clinic, it was late afternoon and they had gone to other hospitals to make evening rounds. Only the nurses were left, but they knew what to do and their performance was commendable. While I started external heart massage by pushing in on his chest, one nurse initiated mouth-to-mouth breathing. Another nurse found a breathing mask, which made it easier to expand his lungs for him. Still another nurse brought the emergency cart containing the pacemaker requirement. Unfortunately, the heart would not maintain its own beat. A complete heart block had occurred. The pacemaker was needed to overcome the block and increase the heart rate from 35 per minute to 80 or 100 per minute. I had to insert a pacemaker wire into the large vein beneath the collarbone, which leads directly to the heart. One end of this electric wire was manipulated through the nervous system, the venous system, and left dangling inside the heart. The other end was attached to a small battery-powered gadget that regulates the heartbeat and overcomes the heart block. The patient began coming to, but whenever I would reach for instruments or otherwise interrupt my compression on his chest, the patient would again lose consciousness, roll his eyes upward, arch his back in mild convulsions, stop breathing, and die once more. Now, each time he regained heartbeat and respiration, the patient screamed, "I'm in hell." He was terrified and pleaded with me to help him. I was scared to death. In fact, this episode literally scared the hell out of me. It terrified me enough to write this book. He then issued a very strange plea. "Don't stop. You see, the first thing most patients I resuscitate tell me soon as they recover consciousness is, 'Take your hands off my chest, you're hurting me.' I'm big and my method of external heart massage sometimes fractures ribs. But this patient was telling me don't stop. Then I noticed a genuine alarm look on his face. He had a terrified look, worse than the expression seen in death. The patient, where are we there? This patient had a grotesque grimace expressing sheer horror. His pupils were dilated, and he was perspiring and trembling. He looked as if his hair was on end. Then still another strange thing happened. He said, "Don't you understand? I'm in hell. Each time you quit, I go back to hell. Don't let me go back to hell." Being accustomed to patients under this kind of emotional stress, I dismissed his complaint and told him keep his hell to himself. I remember telling him, "I'm busy. Don't bother me about your hell until I finish getting this pacemaker into place." But the man was serious, and it finally occurred to me that he was indeed in trouble. He was in a panic like I had never seen before. As a result, I started working fervently and rapidly. By this time, the patient had experienced 3 or 4 episodes of complete unconsciousness and clinical death from cessation of both heartbeat and breathing. After several death episodes, he finally asked me, how do I stay out of hell? I told him I guessed it was a simple principle I learned in Sunday school, that I guessed Jesus, Christ would be the one whom you would ask to save you. Then he said, "I don't know how. Pray for me." Pray for him? What nerve! I told him. I'm a doctor, not a preacher. Pray for me, he repeated. I knew I'd no choice. It was a dying man's request, so I had him repeat the words after me as we worked right there on the floor. It was a simple prayer because I did not know much about praying. It went something like this: Lord Jesus, I ask you to keep me out of hell. Forgive my sins. I turn my life over to you. If I die, I want to go to heaven. If I live, I'll be on the hook forever. The patient's condition finally stabilized and he was to be transported to a hospital. I went home, dusted off the Bible and started reading it. It was on like that. So there you go. That's amazing. Dr. Rawlings.